Well, welcome to February. Here's the condensed version of the town hall. Lots of change going on, much of it very positive, still some challenges and opportunities. I'm going to spend a little bit of time talking about them. First and foremost, I want to update everybody as to where we are with some of our key recruitments. We're in the process of continuing to recruit for a chief of staff. We're also working on our nurse executive, chief of patient care services, as well as re-updating where we are and how we're working HR. Dennis Donahue has been brought in as our new chief of HR. We're working on a new model with Lebanon to have a consolidated office that looks at HR in a much more organized way and prioritizes the hiring for us as we move forward with some of our change plans. To that end, I want to keep driving home our three goals for the year for us here in Wilmington. One is, how do we really become veteran focused? How do we put veterans first? How do we make sure that every day in every service with every employee that we make it clear that we value our veterans by providing quality care in a timely way? Secondly, how do we make this a better place for our employees? How do we ensure that we are building a team here that can meet the goal of putting our veterans first? And then lastly, how do we together work on a culture that promotes fairness, safety, quality, and excellence in everything that we do? So what I now want to do is spend a little bit of time kind of talking to you about where are we with those three goals, how are we being measured across the board, and then what steps we're going to be taking as priorities to ensure that we have the services that veterans need and that we become the preferred provider of choice for our veteran population. Last month I briefly talked about our priorities. I've got teams actively now working on those priorities, including finalizing our org charts so that they're supportable and that we can align our budget with the strategic plan and ensure that services know what FTE they're allowed to recruit for, that they are the exceptional and vital FTE that they need to complete the mission, and that we can move forward with that. We should have that process wrapped up by next month. There should be signed org charts. Everybody should be able to look at the org charts for their service, and everybody should know where we stand with a supportable budget ready service line FTE org chart. We're also working on looking at our bed complement. We're a 16-bed acute facility, 6 ICU beds, 40 continuing long-term care beds, our CLC. The process we've worked on over the last year to look at our utilization management clearly shows us that we need some short-term beds. Christine Mychek, our acting nurse exec, along with members of her team and the chief of staff, are working on a plan to develop a short-term transitional unit here at the hospital to help us better manage veterans that don't need to be in an acute bed, so we have capacity for those that need our acute beds, and that we can get people to the level of care that they need and maximize our efficiency. So we'll update you next month with a detailed plan as to what the timeline is, what the criteria for that unit will be, and when and how we expect to roll that out. Christine is also working with a team to address some of the deficiencies that were noted in our long-term care survey. That team has made monumental strides. I want to compliment the new leadership that was just hired, as well as Sue Pulaski, for leading that effort, and I look forward to making those changes. I know CLC is also implementing a new care model. The differences are noticeable. When I walk through the building, you can see it, you can hear it from our veterans, you can hear it from our staff. So kudos to them for the great work that they're doing, and we just need that to continue to move forward. Additionally, we have some challenges. The Choice program has been problematic for some time. It's left us with a lot of congressionals, a lot of angry veterans about bills, a lot of angry providers about bills. Our case managers, our navigators have been tied up answering those concerns. I'm now working with Ginny Yellen to come up with a new model, a veteran experience office, that will kind of consolidate our veteran advocacy efforts, our voluntary efforts, as well as billing and some new staff that will make that their priority, so that, again, we have services in place that really do demonstrate to our veterans that we put them first. So Ginny will be updating people in the next meeting with a little bit more detailed plan about how that office will be initiated and what are the target dates for a full rollout for that office. Bill Griffiths and Tony Slavinsky are leading the efforts to reorganize our care in the community. We've successfully started the migration to move it over to clinical, which is where it belonged from the very beginning. New models are being put in place with nurse navigators, and we're aligning that program with the PAC teams so that when our veterans get their care, if there's something we can't do, we can get that coordinated right there, same day, same team, watching, monitoring, and connecting our veterans to community when it's something we can't do. Additionally, I'll be working with Christine and Kim Butler to talk about what do we do to the other components of that office, particularly the skilled nursing home care, the contract nursing, the utilization management for when veterans go to the emergency rooms or they're hospitalized in facilities outside of ours. How do we kind of get that care coordination pulled under one umbrella, under one team that can sort of manage that, tie it to what our hospitalists are doing here, as well as tie it to home-based primary care and what that team's doing, so we have a seamless process to keep our veterans safe and at the lowest level of care possible. We'll also continue to work on making some changes with our performance measures and our sale data, particularly looking at our ambulatory care sensitive measures and some of the key components to manage veterans that are at the greatest risk. How do we get them the supports they need so they don't keep cycling in and out of the hospital? The other big thing that underlines all this is quality. The update on that is, and the slides will be available, that we did get the end of the year data on the sale. The good news is we've made great progress. We've had improvement in about 8 key metrics, but the challenges still remain there. We're a 4th quintile or a 2-star facility, so we still have our work cut out for us. And the areas that we're going to focus on when we look at all those metrics are obviously the ambulatory sensitive care conditions, the veteran satisfaction in the care that we deliver, our utilization management, our call-centered responsiveness, as well as 3 to 4 behavioral health metrics that really look at how we deliver the care, how coordinated do we keep the care, and do we have the full spectrum of services available to our veterans. So there's like 8 key indices that we're going to have a team or many teams working on to help us improve access and quality in those areas. And I think if we do that, we'll continue to show improvements in our quality and in our safety data. So that's very exciting. Still a lot of work to do. I want to commend everybody on the progress that's been made, but we still have some things to do to move forward. The other piece to all of that is there's a VISN kind of dashboard that gets created. It sort of distills some of these key metrics from sale into key domains, such as veteran satisfaction, employee satisfaction, quality, and fiscal. Fiscal also includes growth. We're one of the few hospitals that has the opportunity to grow not only in our network but throughout the Northeast. So we need to continue our outreach efforts to really engage veterans and bring them into our system so that they get their care with us, and that we can then provide the care in a fiscally sound and clinically responsible way. So those things are underway. You'll see those domains showing up in everybody's performance plans. We'll be cascading them throughout the system. So what does this all mean to you and to your services? I think the key thing is that we've talked about rounds. We're doing rounds. Many of you see us throughout the hospital. What I'm now going to be looking for is each service to have their boards up that really identify what are the 3 things you're working on in your service. You know, whether you're a unit or you're the logistics team, where do you have your 3 goals listed? And the goals can be focused on improving the veteran experience, improving the staff experience, communication, or care coordination. What are you doing? Does everybody on your team know what you're doing? does everybody on your team know your progress? So a great example, and kudos to 4 East, they've already started this. They have their board up. It's very clear what their goals are. They actually have a board that's visible to veterans that very clearly says, you know, what are they doing as far as fall preventions and how many days have they gone on the unit without a fall to a veteran. It's those kind of things that really will help us hardwire the quality and the safety changes we want, and it will drive home what our priorities are and how we need to really meet those priorities. So that's a key thing that we want to continue to work on. And so when we're doing rounds, we're going to be asking you about the boards. If you don't have the boards, give Sarah Wilson a call. She will help you get a board and that you can get that up. The other thing is the secretary's going around. He's beginning to meet with hospital directors. He's met with all level 3 hospitals. We're a level 2. He's talked to them about what their priorities are, what are they doing in their market, and he's asked them to do a report card on how they're doing, looking at some key metrics. You know, veteran satisfaction, the sale data, employee satisfaction. I'm trying to think what were some of the other ones. Wait times, access issues, leadership. And he's asking facilities to rate themselves. We put together a little bit of a scorecard based on some of the data we reviewed. What I challenged the folks that were here today to do is sort of look at that. How would you rate us as a facility? And then more importantly, as you look at our scores, and we're probably a C. We have a lot of work to do. We've made good progress, but we're not where we want to be. What are the things we need to do in each of those domains to get better? How do we need to make sure that we have good access, same-day access, quality care, that this is a great place to work, that veterans are happy with the care that we're doing, that we follow up, that we're communicating, and that we're living up to those 3 goals that we've talked about earlier on in the process. So there are some key things that we're doing. Just some reminders. Today was, I obviously didn't get the memo, Wear Red Day. We also have Black History Month. There'll be an event on the 15th. We've got some outreach events in the community to better engage veterans. We'll be doing a veteran town hall later this month down at the Star campus in Delaware. Jersey's doing a bunch of outreach, so please check the weekly updates about what's happening in Wilmington. Stay in touch, stay engaged. And then most importantly, we want to celebrate the fact that our Eagles are the Super Bowl champions. One of the things we did was we acknowledged, based on how well we did with the responsiveness to the all-employee survey, that we would have casual football Fridays. In memory and in recognition of the world champions, we're now going to extend that for the remainder of the year. The only thing that I would ask is people be dignified in how they do that. Remember, we're professionals. We need to act and dress professionally, but we want to give people the chance to feel comfortable and to show their team pride, and so you'll be able to do that throughout the rest of the year. The reminder is tomorrow's the parade. You know, it's a work day for all of us, and again, I know people want to show their team pride, so for anybody that wants to do that, they're welcome to bring their jerseys and to celebrate the Eagles championship, and you can wear whatever jersey you want. That's hard for me to say, you know what team I want you to wear, but let's just celebrate the fact that it's been a great time for this community. Let's continue to work hard to take good care of our veterans, and let's keep our 3 goals in mind every day in everything we do. Thanks.